Hi, Lindy. How are you today?
I'm good. How are you?
I'm good, thank you. So today, what would you like to focus on
I
in our
think I
session?
just I think I just kind of want to focus on kind of the trauma that I went through and how I'm just kind of feeling really just kind of weird about it.
Okay. So, what specific memory or issue related to that would you like to talk about?
I think I just want to kind of go back to the memory of it, like, you know, being pushed down and kind of going down the stairs, and I feel like I have flashbacks from it all the time.
Okay. Okay. So, I can see that was a really traumatic experience, and I'm sure it's really difficult to remember. So, today we're going to talk a little bit about when you think about that and the feelings that brings up, and the thoughts that you have about yourself, and what you would like to think instead. So, when you think about the assault, what picture represents the worst part of that incident to you now? When you think about it now, what picture kind of comes to mind that's the worst part about the incident?
I think the worst part was just, and like kind of what comes to my mind is having to go to the hospital and then having to explain it to everybody.
Okay. So kind of the reliving it after it happened
Mhm.
is the hardest part.
Yeah, because I just see it over and over, and I feel like then I have to explain it to people over and over because they don't.
Hmm. Yeah, that sounds really, really hard. What um what words would you say go best with that picture of having to relive that experience and tell people about it that kind of brings up negative beliefs about yourself?
So, like, if I could just describe a couple words.
Yeah, so when you think about that picture of and that memory of having to relive it and describe it over and over again, what words come to mind that kind of explain negative thoughts about yourself?
I feel worthless,
Yeah.
um, sadness, um, like I'm never gonna be able to get over that event.
Okay. So the words that kind of come up for you are worthless and never get over it, it sounds like.
Yeah, or maybe, so you could say maybe worthlessness and then just kind of hopelessness because I don't know how I'm ever gonna get past that.
Okay. Yeah, I that sounds really hard. So when you think about that picture, um what words would you like to think about yourself? What words when you think about it now, what words would you like to have come up?
I would like to be, I would like for it to come up as survivor and, um, you know, forgiveness, not just of what happened, but just for myself to be able to forgive myself and know that it wasn't my fault.
Okay. So when you think about this now, instead of thinking worthless and hopeless, you would like to feel that you're a survivor and be able to forgive yourself and stop blaming yourself for what happened.
Yes, exactly. I want to be able to move on, move forward.
Okay, that sounds like a really hopeful picture.
Hmm.
So when you bring up this picture of having to relive this experience and go over it with people and talk about it, how does that statement of survivor, forgiveness, and move on, how does that make you feel now on a scale of like 1 to 7? So 1 would be like, that's not true at all, I don't believe it. And 7 is like, I really believe that and think that it's true.
I would say like a 5,
A
probably.
5?
Hmm.
Okay. So right now, that possibility of that picture of a survivor and hopeful moving on from it feels like a 5.
Hmm. Yeah, that's because I'm not completely at a 7 yet, so I wouldn't say completely true, but I'm not at a 1 either.
Okay. Um, so when you bring up that picture of reliving that traumatic experience and you're having to tell people the details of your assault over and over when you were at the hospital, and those words of worthless and hopeless, what emotions does that bring up for you now when you think about then?
I feel like it just brings up, um, it, I think it just brings up hurt.
Brings up a lot of hurt.
hmm Yeah,
Okay.
I just don't know. Like, I don't want to be negative, but it's hard for me to be always positive about it.
Yeah, yeah. So even though those feelings are at a 5, of you feel like that could be true even if it's not completely there yet, but still when you think about those feelings and thoughts that got brought up, um, and that come up when you think about you feel really hurt.
Yeah, yeah.
Okay. Yeah, I can. That's totally understandable. Um, So when you think about the assault and this reliving of it and having to be at the hospital, how disturbing for you are these memories? On a scale of 1 to 10, how intense would you say, and like how much does it give? How much does it disturb you? 1 would be not at all. I feel fine, and 10 would be the most disturbing.
I would say it depends on where I'm at. Like, if I'm at home and I feel like
Mm-hmm.
that's where it's happening, even though they're not here anymore, I feel I'm like at a 9. But when I'm in public and around people and I'm not constantly thinking about it, then I would say more like a 6.
Okay. So still pretty high, even if you're um, around other people, but the level of intensity kind of depends on how distracted you are and whether you're by yourself or not.
Yes, because if I'm by myself, I feel like it gives me more time to think about it.
Sure, sure. That makes sense. And if you're distracted and busy and around other people, you're able to kind of move it to the back of your mind. It's not gone, but it's not in the front.
Exactly. Yeah.
Okay. Um, When you think about that and these feelings of hurt and this kind of level 6 to 9 disturbance, where do you feel that in your body? Like, where do those kind of feelings originate from in your body?
I always feel like it's in my chest, almost um, like when I'm at home and I start thinking about it, and then I just like even go back to my room or some of the events, like I feel like my heart's beating real fast, almost like I'm having a heart attack. Now,
Mm-hmm.
if I'm at like the 6th level, then I
Mm-hmm.
feel like it's more like it's still a thumping, and I know like I'm kind of anxious that people are going to ask me about it or that we have to talk about it. But when I'm in that higher range, then I'm more like where I really feel like I could have a panic attack.
Okay. So it's really kind of localized to your chest and that feeling of panic and kind
hmm
of energy from your heart
hmm
in your chest.
And almost tense, like in my shoulders, because I feel
Mm-hmm.
like I'm tense all the time.
Sure. So you feel really tense, kind of waiting almost for, like you said,
hmm
you're tensed up waiting for somebody to ask you about it or worrying if you're going to have to talk about it.
Yeah,
Okay.
exactly.
So when you're feeling like this and you're feeling at a 9 or, 6 to 9, what kinds of things are you doing to cope with that?
So, so if I'm like at home, I really try, like if I start having that feeling, I try to either use my mindfulness meditation techniques that we've kind of gone over, or
Mm-hmm.
I try to call my sister, who's like the big support in my life, so then I'm not
Mm-hmm.
sitting in silence. But if she doesn't answer, then I try to go back to those techniques that we've worked on. Now,
Mm-hmm.
when I'm in public and people ask me about it, and I can feel myself getting anxious, I just really try to um, like get my chapstick out and kind of do that sensory thing that we were talking about, and
Mm-hmm.
where I really like it. So it's something that kind of calms me down. It's something that I want to do. And then I really have been trying to be more assertive with my communication and kind of tell people like this is not appropriate to talk about right now, or I don't want to talk
Sure.
about it.
Well, that's great. Those sound like all really good ways to cope with it. You should be really proud of yourself.
Thank you.
So, as we continue talking about this, the goal is that we can move that 5 of how um, much you trust this belief that you're a survivor and you can forgive yourself and that things weren't that happened weren't your fault. We want to move that closer to a 7. So, um, what do you think is one thing that could help you move from a 5 to a 7 in that?
I think maybe just feeling more confident in myself and not
Hmm.
being so doubtful because, and just being realistic and knowing that kind of the stuff that went on um, is not going to happen with that same person again because they're not in my life anymore or even any
Hmm.
can't even be around me anymore. So just trying to be mindful that I can be safe in my own home.
Sure. So reminding yourself of your safety and doing things that make you feel safe, and hopefully as we continue to talk about this, we can talk sort of about more about where those feelings of hopelessness and worthlessness are coming from, and other things that we can do to help move that 5 to a 7. So we'll
Yes.
continue talking about that next week.
Okay,
Keep
that
using
sounds
your
great.
coping skills, or you're doing a great job with that, and keep using your sister as support. And we'll talk next week, okay?
Okay, sounds great. Thank you.
Okay, great. Thanks.